Are you over 70 and still getting medical tests that could actually harm you more than help you? Most seniors believe every screening their doctor recommends is protecting their health. But leading medical institutions now say certain tests after 70 often lead to unnecessary procedures, complications, and treatments that do more damage than good. Today, I'm revealing 5 commonly recommended medical screenings you should seriously reconsider. And one of these tests is still routinely ordered, despite research from Johns Hopkins showing it triggers unnecessary surgeries in over 60% of cases. Helen, a 73-year-old from Tampa, went for her routine annual screening last spring. The test flagged an abnormality, leading to 3 follow-up procedures, including a biopsy that caused serious complications. After 2 months of recovery and mounting medical bills, doctors finally confirmed nothing was actually wrong. Helen had endured invasive procedures she never needed in the first place. This happens to thousands of seniors every single year. The medical community has learned that after a certain age, some screenings create more problems than they solve. False positives become more common. Treatments carry higher risks, and many detected conditions would never actually threaten your health or lifespan. The challenge is that most doctors continue ordering these tests out of habit or liability concerns, rarely explaining the real risks versus benefits for someone in their 70s or beyond. Understanding which screenings deserve a serious conversation with your physician could save you from unnecessary anxiety, invasive procedures, and genuine health complications. Let's examine 5 medical checks that deserve your careful questioning after age 70, starting with one that surprises most women. Medical check 1, annual pap smears after age 65. Still getting annual pap smears well into your 70s? You're not alone. Many women continue cervical cancer screening long past the point where it provides meaningful benefit. The U.S. Preventive Services Task Force and the American Cancer Society both state clearly that women who've had adequate prior screening and normal results can safely stop cervical cancer screening at age 65. Cervical cancer develops very slowly, typically taking 10 to 20 years to progress from early changes to invasive cancer. If you've had consistent normal screenings throughout your adult life, the chance of developing cervical cancer after 65 is extremely low, less than 1 in 1,000, according to research published by the National Cancer Institute. The problem with continuing pap smears after 65 is that false positives become increasingly common. As your cervical tissue naturally changes with age, tests frequently flag abnormalities that aren't actually precancerous or dangerous. These false alarms lead to follow-up procedures like colposcopies and biopsies that carry real risks, including infection, bleeding, and significant discomfort. Beatrice, 71, from Columbus, experienced this firsthand when her routine pap came back abnormal after decades of normal results. The follow-up biopsy was painful and caused bleeding that required a week of restricted activity. 3 anxious weeks later, the results confirmed everything was completely normal. The initial test had simply misread age-related tissue changes as suspicious. If you've reached 70 and had consistent normal pap smears throughout your life, this is a screening you should discuss stopping with your doctor immediately. The American College of Obstetricians and Gynecologists supports discontinuing screening for women with adequate prior testing and no history of precancerous findings. There are exceptions if you have a history of cervical cancer, HIV, a weakened immune system, or were exposed to DES before birth. Continued screening may still make sense. But for the vast majority of women over 70 with a history of normal results, the risks of continued testing outweigh any potential benefits. Talk to your doctor this week about whether you truly need this screening anymore. Medical check 2, routine PSA testing for prostate cancer. Are you still getting annual PSA blood tests? Millions of men over 70 continue routine PSA screening without understanding the significant downsides. The Mayo Clinic and the US Preventive Services Task Force have raised serious concerns about PSA testing in older men, particularly those over 70. The fundamental issue is that PSA tests frequently detect slow-growing prostate cancers that would never cause symptoms or shorten your life. Research from the New England Journal of Medicine found that many men diagnosed through PSA screening undergo treatments with serious side effects for cancers that pose no actual threat to their survival or quality of life. False positives are remarkably common with PSA tests. Elevated PSA levels can result from benign prostate enlargement, infection, inflammation, or even recent physical activity, none of which indicate cancer. When PSA levels come back elevated, standard protocol typically calls for a prostate biopsy. These biopsies carry genuine risks, including serious infections, bleeding, pain, and difficulty urinating. Vernon, 74, from Minneapolis, had an elevated PSA that led to a biopsy revealing slow-growing cancer. His urologist recommended immediate surgery. Vernon underwent the procedure, which left him with permanent incontinence and other quality-of-life issues. 5 years later, his oncologist admitted the cancer was so slow-growing it likely would never have progressed enough to cause problems during Vernon's natural lifetime. The data shows that screening 1,000 men over 70 might prevent one death from prostate cancer, but leads to dozens of men experiencing serious complications from biopsies, surgeries, and treatments. Johns Hopkins research indicates that for men over 70, especially those with other health conditions, watchful waiting often proves safer than aggressive screening and treatment. If you're getting routine PSA tests, sit down with your doctor and have an honest conversation about whether the benefits truly outweigh the risks at your age and with your overall health status. Don't let unnecessary screening push you toward treatments you genuinely don't need. Medical Check 3. Annual mammograms past age. 75 mammograms have saved countless lives through early breast cancer detection, but after 75, the calculation changes significantly. The American Cancer Society guidelines note that women over 75 should make individual decisions about continuing mammograms based on their overall health, life expectancy, and personal values. Harvard Medical School research shows that for women over 75, especially those with other serious health conditions, mammograms increasingly detect slow-growing cancers that would never become life-threatening. The natural course of breast cancer typically takes years or even decades to progress, and many cancers detected in women over 75 would never cause symptoms during their remaining lifespan. False positives become substantially more common as you age. Breast tissue changes naturally with age, and mammograms frequently flag these benign changes as suspicious. This triggers a cascade of follow-up appointments, additional imaging, biopsies, and months of anxiety. Gladys, 78, from Denver, got a call back after her annual mammogram requiring additional views and ultimately a biopsy. The procedure was painful and left bruising for weeks. After 3 months of worry and multiple doctor visits, the results confirmed the finding was completely benign. Gladys spent an entire quarter of her year dealing with medical appointments and stress over something that was never actually dangerous. The key consideration is your overall health and realistic life expectancy. If you have significant heart disease, diabetes, COPD, or other serious conditions that are more likely to affect your lifespan than breast cancer, continuing mammograms may not serve your best interests. The stress of false positives, the risks of biopsies, and the potential for treating cancers that would never cause problems deserve serious consideration. Cleveland Clinic oncologists emphasize that the decision should be personalized based on your individual health status, rather than simply continuing screening indefinitely because that's what you've always done. Have an honest conversation with your doctor about your individual risk factors and whether continuing mammograms truly make sense for your situation now. Medical check 4. Routine. EKGs for asymptomatic individuals. Getting yearly EKGs. Even though your heart feels perfectly fine, the American Heart Association and Johns Hopkins cardiology research indicate that routine EKG screening for people without symptoms or known heart disease provides minimal benefit while creating potential for significant harm. An EKG measures your heart's electrical activity, and while it's valuable for diagnosing problems in people with symptoms like chest pain or shortness of breath, using it as a routine screening tool in healthy individuals frequently leads to false alarms. Studies show that abnormalities detected on screening EKGs in asymptomatic people rarely indicate actual heart disease requiring treatment. The real danger lies in what happens after a false positive. When an EKG shows something unusual in someone without symptoms, doctors typically order follow-up tests like stress tests, echocardiograms, cardiac CT scans, or even cardiac catheterization. These procedures carry their own risks and costs, and the vast majority ultimately reveal nothing actually wrong. Howard, 72, from Austin, had a routine EKG during his annual physical that showed a minor irregularity. His doctor ordered a stress test, which came back borderline, leading to a cardiac catheterization, an invasive procedure where they thread a catheter through your blood vessels to your heart. The catheterization found Howard's arteries were completely clear, and the EKG abnormality was simply a normal variation for his age. He'd undergone an invasive procedure with genuine risks for absolutely no medical benefit. The U.S. Preventive Services Task Force explicitly recommends against routine EKG screening for cardiovascular disease in adults without symptoms. The false positive rate is simply too high, and the cascade of follow-up testing creates more problems than the screening solves. If you have symptoms like chest discomfort, unusual shortness of breath, or known heart disease risk factors, an EKG makes perfect sense. But if you feel fine and have no concerning symptoms, adding a routine annual EKG to your checkup isn't protecting your health. It's creating opportunities for unnecessary downstream testing. Question every test your doctor orders and ask directly whether it's truly necessary for someone without symptoms. Medical check 5. Routine thyroid function. Screening doctors frequently check thyroid levels during routine blood work, but the U.S. Preventive Services Task Force states there's insufficient evidence to recommend routine thyroid screening in asymptomatic adults. The problem with routine thyroid testing in seniors is that minor abnormalities are incredibly common and rarely require treatment. Your thyroid naturally changes as you age, and slight variations in thyroid hormone levels often represent normal aging rather than actual thyroid disease. Cleveland Clinic endocrinologists emphasize that treating mild thyroid abnormalities in seniors frequently causes more problems than it solves, particularly when the person had no symptoms before the test. When routine screening detects a slightly abnormal thyroid level, many doctors immediately start treatment, even though the patient felt perfectly fine. Thyroid medications require careful monitoring, frequent dose adjustments, and can cause side effects, including heart palpitations, anxiety, bone loss, and sleep disturbances. The American Thyroid Association notes that overtreatment of subclinical thyroid conditions, where lab values are slightly off but you have no symptoms, is a significant problem in medical practice. Irene, 76, from Seattle, had routine blood work that showed her thyroid level was slightly elevated. Her doctor started her on medication immediately. Within weeks, Irene developed heart palpitations and insomnia she'd never experienced before. After 6 months of dose adjustments and mounting side effects, her endocrinologist took her off the medication entirely, noting she'd never actually needed treatment in the first place. Unless you have clear symptoms like unexplained weight changes, extreme fatigue, severe hair loss, or temperature sensitivity, routine thyroid screening may create problems rather than solve them. The New England Journal of Medicine published research showing that treating mild thyroid abnormalities in older adults without symptoms doesn't improve quality of life or prevent future health problems. If you're feeling well and your doctor wants to check your thyroid levels just to see, ask pointed questions about what they'll do if the results are slightly abnormal and whether treatment would genuinely benefit you. Take control of your healthcare decisions starting today. Understanding which medical tests truly benefit you after 70 empowers you to be a smarter healthcare consumer. These 5 screenings, Pap smears after 65 with adequate prior testing, routine PSA testing, mammograms past 75 depending on your health status, EKGs without symptoms, and routine thyroid screening, all deserve serious discussion with your physician rather than automatic continuation. The right approach balances potential benefits against real risks of false positives, unnecessary procedures, and treatments that may harm more than help. You have every right to ask questions, request explanations of actual benefits versus risks, and make informed decisions about your own body and healthcare. Have you ever questioned a medical test with your doctor or experienced unnecessary follow-ups from a false positive? Share your story in the comments below. Your experience could help thousands of other seniors make better informed healthcare decisions. If this information empowered you to take control of your medical care, give this video a thumbs up and subscribe for more honest, evidence-based health guidance. Share this with friends and family over 70 because this information could save them from procedures they genuinely don't need.